Thank you. My name is Dr. Ammarah Zaidi. My presentation on severity of anemia and its association with socio-demographic characteristics in pregnant women of rural areas. First of all, the summary: the maternal anemia is big leading factor to mortality and morbidity in both the unborn child and the mother, which is most common in our country, especially. Can you hear me? Especially in rural areas. According to our study, there are multiple. Can you hear me? Multiple factors are responsible, like as. Can you hear me?
Yes, we all are hearing you. You please continue.
Thank you. Okay. First of all, the maternal anemia is big leading factor to mortality and morbidity in both the unborn child and the mother, which is most common in our country, especially in rural areas. According to our study, there are multiple factors are responsible, like as multigravity, low socioeconomic status, inadequate dietary intake, absence of iron, folate supplement, and overload of work note significantly associated with severity of anemia in pregnant women. Its the p-value is probability value is 0.001. The normal value is 0.05. So what data in literature exhibited that hardly few studies published in Pakistan regarding socio-demographic factors effects on anemia during pregnancy, especially in rural areas. Importance behind this research is providing valuable data which should assist in detected possible field for particular intervention from improvement in reproductive health. The background of this study: my study's background is anemia characterized as a reduced hemoglobin level in blood. Anemia during pregnancy is a chief reason of mortality and morbidity of pregnant females among underdeveloped nations, as well as both fetal and maternal effects. It is approximated that anemia lead to above 115,000 maternal and 591,000 prenatal mortalities around the world annually, as per WHO approximates of the worldwide burden of mortality is attributed to anemia in female of reproductive age varies through 1,600, 1,600, 28,000 per annum, along a higher risk of anemia associated mortality among younger females. Majority of the studies published are from tertiary and secondary healthcare centers. It is clearly a problem to responsible distribution of sources directed towards that. Hardly few studies published in Pakistan have accounted the contribution of socio-demographic factors effect on anemia during pregnancy, especially women involved in the overload of work during pregnancy without antenatal care. Therefore, this study was the conduct to establish the severity of anemia and its association with socio-demographic factors in pregnant female in rural areas of Pakistan. My study's method is a cross-sectional study, was performed at government and private rural medical centers and maternity homes. Women with second and third trimester were selected in this study. Each female was interviewed and data regarding socio-demographic characteristics as per ID, gestational age, and education, occupation, and dietary habits were recorded. Dietary intakes were estimated as adequate and inadequate as per WHO criteria. The anemia pregnant women in classified into mild, moderate, and severe. Mild is a 90 to 110 gram per liter. Moderate is 70. The results of the total 120 pregnant women more than 12 weeks of gestational age were incorporated. Mean age is 37 to 36, 33 years, or mean gestation age was 34 or 30 weeks. According to severity of anemia, 18% and patient in normal hemoglobin 41 had mild anemia, 25% had moderate anemia, 15% have severe anemia. Multigravity, low socioeconomic status, inadequate dietary intake, absence of iron, folate supplements, and overload of work noted significantly. The severity of anemia in pregnant women p-value is 0.001, while majority of uneducated women were found with severity of anemia, but no significant difference was found. P-value is of 0.8. And in the severities of anemia, there is a distribution of the patient according to the anemia. Normal hemoglobin is 18.34% only. Mild anemia 41.60%. Moderate is 25% and severe is a 15%, as I told you before. Anemia association with socio-demographic characteristics in that is the primary gravida is and multigravida. The normal 8 is the primary gravida and multigravida 14. The p-value probability value is 0.001. Uneducated is 0.08. So that is the significantly not clear the data, and the normal value of this p-value is zero point 0.5. So that's why this value is not significant. Again, a distribution of this is a adequate dietary intake and non-adequate. Adequate dietary intake 18% and inadequate 4%. So again, the p-value is of 0.001, and this is a folate dietary intakes. Some are again is the p-value, the probability value is 0.001. So only the 0.05 values is only the field worker. So that's why it's not significant data. Conclusion: a high incidence of anemia lies among rural pregnant females, low socioeconomic status, inadequate dietary intake, absence of iron and folate supplement, and overload of work are noted significantly associated with severity of anemia in women. Future steps of multi-center rural research is required to comprehend the anemia pathogenesis amongst pregnant cases from various culture, families, and primary health. Thank you.